Masturbation is a subject that often carries a sense of hesitation or even guilt for many, especially as they enter their later years. If you're someone in your 50s or 60s, it's natural to question whether engaging in self-pleasure remains healthy, or if it could, in some way, be harming you. The answer to this is not straightforward, as there is no simple yes or no. But rest assured, you are not alone in wondering about this. There is a great deal of confusion and often outdated myths surrounding the topic, and a distinct lack of clear, reliable information. This is especially true for men who find themselves in the later stages of life, where concerns about hormonal balance, prostate health, and sexual performance are more pronounced. It's no secret that, as men age, they face a variety of health concerns, many of which affect sexual health. Erectile dysfunction, changes in libido, and worries about prostate health are common. But with the advent of new studies and a growing body of research on the topic, masturbation in maturity is starting to be viewed in a new light, rather than focusing solely on the physical aspects. Many experts are recognizing the psychological and emotional benefits that come with this act. Let's take a deeper look into what modern research reveals about masturbation's role in older age. Its surprising benefits, as well as potential risks that are important to keep in mind as we age. Maintaining penile health becomes increasingly important. One of the key benefits of masturbation is that it helps maintain good blood flow to the penis. When you achieve an erection, blood flows into the spongy tissues known as the corpora cavernosa, which essentially acts as a workout for the tissue. This regular blood flow and muscle stimulation help maintain tissue elasticity, a crucial factor in keeping the penis in good shape for longer. This means that the simple act of self-pleasure can contribute to the overall health of the genital area. Another significant benefit of masturbation, especially for men over the age of 50, is its potential role in promoting prostate health. Research has shown that regular ejaculation can lower the risk of developing prostate cancer. This theory stems from studies like one conducted by Harvard University, which found a connection between frequent ejaculation and a reduced likelihood of prostate cancer. By regularly ejaculating, the prostate is essentially flushed of potentially harmful substances, contributing to a healthier prostate gland over time. Masturbation also strengthens the pelvic floor muscles, which are vital for maintaining erectile function and preventing urinary incontinence, a common issue for aging men. The rhythmic contractions of the pelvic muscles that occur during orgasm engage the pubococcygeus muscle, which plays a key role in these functions. A strong pelvic floor can, therefore, contribute to better sexual health and control, which can also be helpful for men experiencing challenges related to incontinence. Stress is a pervasive issue for many, and aging is no exception. Masturbation can actually act as a stress reliever by reducing the levels of cortisol in the body. Cortisol is the hormone most associated with stress, and research has shown that orgasm can lead to a significant drop in cortisol levels, promoting both mental and cardiovascular well-being. This means that masturbation is not just good for your body, but also for your mind. As you reach older age, mental well-being becomes even more important. Masturbation helps release a range of neurochemicals in the brain, including dopamine and oxytocin. These chemicals are responsible for feelings of pleasure, bonding, and emotional well-being. By engaging in self-pleasure, you're giving your brain a natural boost of these chemicals, which can improve your mood and provide emotional relief. This becomes especially important as we age, when emotional health often takes a back seat to physical health concerns. Masturbation also offers a form of self-detection. By regularly engaging in self-pleasure, men become more familiar with their own bodies, which can help them detect any abnormalities or changes that might otherwise go unnoticed. Conditions like testicular cancer, penile fibrosis, or other potential issues can sometimes present subtle symptoms, but regular self-examination through masturbation can help catch them early, which is vital for successful treatment. Another surprising benefit is the improvement in sleep quality. After orgasm, your body releases a combination of hormones like oxytocin and prolactin. These hormones work to promote relaxation and induce a sedative effect, making it easier to fall into a deep and restorative sleep. Sleep disturbances can become more common as we age, so this natural sleep aid could be a particularly valuable benefit. Masturbation also contributes to overall pelvic blood circulation, improving blood flow not only to the penis, but throughout the pelvic region. This can benefit other organs and muscles in the area, including the bladder and prostate. Good circulation prevents stagnation and ensures the health of surrounding tissues, which can help prevent issues that come with poor blood flow. For those struggling with premature ejaculation, masturbation can actually serve as a form of training. By practicing techniques such as the stop-start method, men can gain better control over their ejaculatory reflex. The private space provided by masturbation allows men to experiment with techniques and build awareness of their body's signals, which can translate to better control during partnered sex. Lastly, masturbation helps keep the brain's sexual circuits active. The brain is the largest sex organ, and by regularly engaging in sexual fantasy and stimulation, men can keep their neural pathways associated with arousal and desire active. This is important for maintaining a healthy libido, even when there is no regular sexual partner. The brain's role in sexual health cannot be overstated, and keeping it engaged is crucial for maintaining sexual responsiveness. While these benefits of masturbation are well documented, it's also important to acknowledge that it is not without its potential risks, especially for older men. Just as with any activity, moderation and awareness are key to maintaining a healthy balance. One of the first risks to be aware of is social isolation. When masturbation becomes a substitute for human connection, it can lead to emotional withdrawal. It's important to ensure that self-pleasure is a healthy part of a broader, fulfilling sexual and emotional life, rather than an escape from it. Social connections, physical intimacy, and emotional relationships are crucial for overall well-being, and masturbation should complement these, not replace them. Another risk is the possibility of developing skin microlesions. These tiny tears can occur when masturbation is performed too aggressively or without adequate lubrication, leading to irritation, inflammation, and an increased risk of infection. The solution is simple: be gentle and always use a good quality, water-based lubricant to prevent any damage to sensitive skin. Desensitization is another concern for men who may masturbate in the same way, using the same rhythm and pressure every time. Over time, this repetitive stimulation can train the brain to become conditioned to just that specific touch, which may make it more difficult to achieve arousal or orgasm with a partner. To avoid this, it's important to vary your technique and focus, which helps keep the brain's sexual responses flexible and responsive. Masturbation can also sometimes mask underlying health issues. If a man is able to achieve an erection during self-pleasure, but struggles to do so with a partner, it could be a sign of a deeper issue, such as heart disease, diabetes, or hormonal imbalances. It is essential not to ignore these symptoms, but to consult with a healthcare professional to rule out any serious conditions. Another risk arises from poor posture during masturbation. Sitting in a hard chair or hunching over while engaging in self-pleasure can compress the pudendal nerve, which runs through the pelvic region. Over time, this can lead to numbness or pelvic pain. To avoid this, it's important to practice in a relaxed and comfortable position, such as lying down with proper support to prevent nerve compression. Masturbation, when used as an emotional escape mechanism, can also become problematic. If it is the only tool a man uses to cope with stress, frustration, or boredom, it can create a dependency, preventing him from seeking healthier alternatives, like exercise, meditation, or talking with others. It's important to have a diverse toolkit for managing emotions and not rely solely on self-pleasure. For men who grew up with negative cultural or religious beliefs around masturbation, feelings of guilt and shame can persist into adulthood. These feelings can be emotionally damaging and may hinder the enjoyment of a completely normal and healthy activity. Seeking therapy from a sex-positive counselor or therapist can be incredibly helpful for reframing these beliefs and fostering a healthier relationship with self-pleasure. Excessive masturbation, particularly when done multiple times a day over a long period, can sometimes lead to a feeling of pelvic congestion. This manifests as heaviness or aching in the testicles or pelvic area. Moderation is key here. It's essential to listen to your body and make sure you're not overdoing it. For men trying to conceive, there is also the concern that frequent ejaculation could temporarily impact sperm quality. While this is not a long-term concern, ejaculating daily may reduce sperm concentration. To optimize semen quality, studies suggest a period of 2 to 5 days of abstinence before attempting conception. Lastly, there is the issue of pornography. If masturbation becomes heavily reliant on unrealistic or extreme pornography, it can skew expectations and create a disconnect between fantasy and reality. This can lead to difficulties in connecting with a real-life partner. The key is to balance any visual aids with real-life experiences and memories to keep the act grounded in reality. As you can see, masturbation is neither inherently good nor bad for men over 50. Its effects depend on how it's practiced, with the key being awareness, moderation, and respect for the body. When approached with balance and mindfulness, masturbation can serve as a powerful tool for maintaining sexual health, emotional well-being, and overall vitality. It's a natural, healthy part of life, and when practiced responsibly, it can support a fulfilling, vibrant lifestyle well into your later years. If you found value in this video, please give it a like and subscribe for more straightforward, well-researched advice on mature health. Don't forget to hit that notification bell so you won't miss our next conversation. Stay healthy, and I'll see you in the next video.